Whether you are suffering with pain from an athletic injury or simply just the effects of getting older, you might be surprised to learn about an option here in Southwest Florida that can help without the surgery.
Yeah, it's called prolotherapy. It's creating a lot of buzz in our area, and let us introduce you now to the doctor who is bringing this non-surgical option to Southwest Florida. From Caring Medical Center, I am so happy to welcome back to the show this morning once again Dr. Ross Hauser. Good morning.
Good morning.
He's also a prolotherapist, which you have not heard about prolotherapy. We're going to get to that in just a second. It's very interesting what's going on right here in Southwest Florida, what's available for people. And this morning we're going to talk about failed back surgery syndrome, which unfortunately I think a lot of people are going through. I didn't really realize it was as common as what it is until after talking with you. And a lot of people, they have surgery on their back with hopes of not being in pain anymore, but it comes back.
The most common reason people have back surgery often is because they have sciatica. The nerve is getting pinched. Then the surgeon does a really good job of unpinching the nerve, but then they're still left with residual pain, back pain. And the most common reason that they have residual pain is that the pain is actually coming from a different structure. This is actually a low back.
Okay.
So the vertebrae are here. You can see the L5 vertebrae here. This is the iliac crest. This is the sacrum.
Okay.
So it's very common for somebody to have surgery on their disc or even have a fusion. But then the pain changes because they also have an injury to their sacroiliac joints. This is the sacroiliac joint. So prolotherapy is very, very effective at resolving sacroiliac pain or low back pain because prolotherapy helps stabilize the structures. Prolotherapy, by stimulating the normal healing cascade, could take these injured ligaments, which are causing the bones to move too much. Like that's what causes most chronic pain, is that a person has joint instability, which is just meaning that the bones are moving too much. So prolotherapy, by stimulating the repair of the ligaments, which connect the bones, the back then has stability and strength, and the person can go play golf, go play tennis.
And that really is the key here with prolotherapy, which I'm going to have you dive into a little bit more, is that joint instability. That is what you feel is going on with people that needs to be looked at, and what prolotherapy does, right?
People can only do the things they do if the musculoskeletal system has strength. Joint instability means the connections of the bones is loose. So the body, to stabilize that area, like the back, the muscles will go into spasm to stabilize that structure. If that doesn't work, the body will swell it. Like if you have instability of your knee, the knee will keep swelling. So the cause of the knee swelling or the chronic muscle spasms is underlying joint instability.
But that's where prolotherapy comes in, and that you may be able to help with that. So what is prolotherapy? How do you help with that joint instability?
Prolotherapy is a natural injection therapy. So it stimulates the body's natural healing mechanisms to stimulate the growth of ligaments, tendons, cartilage, other joint stabilizing structures. So any degeneration in the back, in the knee, a tendon tear, ligament tear, can be healed or stimulated to heal with prolotherapy. So all we're doing is restarting the healing process. So you had a back injury, it didn't heal. You need to restart the healing process. So we do that by an injection technique, a natural injection technique called
prolotherapy.
prolotherapy.
What people like to hear is that it's natural. It's coming from your own body. It's nothing foreign that's coming, in.
There's two types of solutions we use. One is like the natural sugar in the body called D-glucose. Or sometimes we'll take out substances from your own body, from your blood, from your bone marrow, from your fat, and we'll use that as the proliferant. So in other words, we'll do what normally happens in the body to repair an area to get healing.
So what's the best, if someone is interested in this and thinking, you know what, maybe, and again, what you don't want to happen is maybe they don't have to have surgery. Maybe this can be looked at as an option before somebody has to go into surgery.
Yeah, that would be ideal.
Yeah, obviously. So if someone's watching this morning and thinks, I've never heard of this before, I want to try this out, what do you suggest they do? I mean, what's the best way
we have
to
a
find
center
out
now in Fort Myers, Florida.
Welcome to Southwest Florida.
Yes.
Best thing to do, I know you have a website too where you can certainly find out more, caringmedical.com, but certainly give Dr. here a call and find out if this is an option. And I know you're very interested to hear from people, hear their stories, and see if you're able to help them.
Yeah, absolutely. Thank you.
Well, thank you so much for letting us be here this morning. We look forward to having you back, Doctor. For more on Caring Medical, all you have to do is head to our website, fox4morningblend.com. And remember that word, prolotherapy. Again, I think we're going to be hearing a lot more about what they are doing, and then just what prolotherapy in general can do.
What a terrible way to live, to have that joint pain like that.
Yeah,
so
nonstop.
good news with this.
Well, confused over the new health care law? No problem.
No problem. Up next, how the experts at Health Markets are here to walk you through the process every step of the way.